Hi, my name is Pat, and I'm doing an emotional release therapy session here on Katie. Um, I use this is not an Amane session, it's an emotional release therapy session. I use the Amane technique and I do inner child work. But the technique of just opening the body is Amane. So many people just think it's Amane. This is different than Amane. Okay, and the way that I'm going to start is by having Katie breathe. She breathes through the mouth, take breath. Yeah. The reason that she breathes, and I'm just going to do it in the way that I do it on somebody who's first coming into a session so you can see. Trying to bring her down into her body where the things are stored. She's coming into the emotions which I described in the first video that you saw, that she's holding, and I'll be opening these doorways. There's numerous doorways in the body, probably 250, that hold either fear, anger, trauma, whatever we didn't get to express, that was not safe to express when she was younger, is holding now, and you can feel in the different places in these doorways where these feelings are being held. There's no more stories in this body. Whatever happened, happened in her life already. It's done, finished, over, except for if there's holding, she didn't get to express the feelings around it. So the first step for me is to bring her into her body. Big breath is to guide her to come into her body. And feeling my hands, if you can, Katie. Can you feel them?
Yes.
Is one different than the other?
The bottom hand feels warmer.
So the bottom one feels warmer. Taking a big breath to it. And I don't know exactly where I'm going to work, so I'm going to kind of check like this to see where I feel the holding in the doorways. These are all doorways here. I can feel all this. I can feel this. You can feel she's holding in here. You can feel it too. Katie, you can feel every place. Nothing's supposed to hurt in the body in any of these doorways. Things hurt when they've been holding tightly and they've been holding for so long. Okay, so the first step is we always open the heart. And that's right here. Always open the heart, because even though every doorway is opened, or whatever doorway is open, even though I might only work one doorway in a session, the emotions come out through the heart. So I want to find out where she is right now. Is she in her body or not? So take a big breath. That's it. I'm feeling this right here. That feels like this. Katie, yeah. Big breath to this. This is the doorway to the heart. So I'm going to find out from Katie where she lives right now. Is she out here? Is she in there? Where is she in her head? Where is she? So I'm going to ask her what this feels like when I do this. Feel that?
It hurts.
Yeah, it hurts. Big breath. Yeah, it hurts. Come down. Yeah, she's already coming in. She comes in very well. So it hurts. Can you see my thumb? And then I'm just doing this to show you, to find out where somebody lives. Can you see the thumb?
Yeah.
Where are you looking at it from?
I can see it from the inside.
From underneath?
Yeah.
Okay, so right now I know she lives in her body. She's in her body because she sees the thumb. When people aren't in their body, they'll tell me they see the top of my thumb, and they'll be floating out here. And people are floating out here or out here because they left their bodies because it was too much. Whatever was in there was not safe, and it was too much. So you can see the thumb from underneath.
Yeah.
Can you see the doorway that feels like this? Right here.
Yeah.
Yeah. What does the doorway look like?
It's a small door. There's light behind it.
Okay. Is it opened or closed?
It's halfway open.
It's a small doorway with light behind it. It's halfway open. Can you see what it's made of?
Wood.
Wood. So some people it's iron, some people it's steel, some people it's glass. What it's made of shows how much protection. Hers is wood, wood. You said it's partly open?
Yeah.
Yeah. Are you looking at it from inside or out?
Inside.
All right, come closer to the part of you that's looking at it from inside. See if you can see her. She's standing, sitting, laying down.
She's sitting.
She's sitting. Come closer. How old is she about? and look in her eyes. What do you see?
Loneliness.
Yeah, she's lonely. Keep looking. She's lonely. 7-year-old. Katie sees a 7-year-old with loneliness in her eyes. Take another breath. Loneliness that she didn't get to express. She's lonely. Another breath. And having to hold that loneliness. Is there any other feeling in her eyes? Look very closely. Yeah, take a look at her. She's sad. When somebody's lonely, I don't know if lonely is a feeling, because when somebody's lonely, they're sad. She's sad. This particular 7-year-old is sad around the loneliness. Take another breath, and to hold the lonely 7-year-old, for her to hold these sad feelings, yes, keep coming to it, yes. Yeah. And all we're trying to do is finish the expression of what she didn't get to finish then, which Katie's 37, which follows her all the way up now, because I'll bet you in her life now she feels lonely and sad. We're not digging up the past. The past comes to the present. Yeah. And she's just finishing what she didn't get to finish. Yeah. So this has been held in. She's 37. This has been held in for about 30 years. She's probably, this part has been running the show, you know, and she's probably been bringing situations into her life over and over that bring her loneliness and sadness. Yeah. So she's just finishing what she didn't get to finish. You're wondering why can she just start doing this? She left her mind. She's not in her mind, she's in her body. She surrenders her mind to her body, and she can come in here. And she can let it go. And the way she probably survived in the world is not to be in here and to come up here. So she wouldn't have to feel this stuff. Because it wasn't okay. That's it. Keep coming towards it. Yes. She's just finishing. And I can move this along a little and go like this, a little bit, activate a little bit more. Here it is, Katie. It doesn't mean she's going to finish it today. You can see our camera person's getting a little sad back there. When she can come all the way into this, all the way, that's it. This can finish. This can finish. This 7-year-old that tethers all the way to this 37-year-old that's probably been feeling sad and alone for the 30 years of her 37 life. Is that right in any way? Yeah. So I'm going to move this onto this a little bit, and I'm going to show you. I want to show you something else. What happens because Katie has another part of her. She has another part of her for the 7-year-old. Yeah. Stay with her. Stay with her. Stay with her. And focus on the open hand for a moment. Just for a moment if you can. Just focus on the open hand. She's not finished with this. You know, for me personally, with anger and sadness, it took me years. I had so much in me, yeah. And I didn't know I had this open hand part. See if you can, for a moment, feel the open hand.
Yeah.
Stay with it. Breathe to the open hand. Just for a moment. I don't want to stop her expression, but it could. She's been holding this for a long time, obviously. Am I right?
Yeah.
You know, so I'm speeding this up for a second so you can see. I'm not trying to stop you because I know that there's a young girl in there that is now 37 that has been holding this sadness because she's been alone for a long time. Let her feel this for a moment if you can. Just let her feel the open hand. See if you can feel it. Breathe it. Yeah. What does this open hand feel like?
It feels comforting.
Yeah, it's comforting. The open hand is comforting. Anything else?
Feels like love.
Feels like love. So I wanted to tell you this, and you're not going to believe it, but it's true, I swear to you, is that this comfort and this love is the unwounded part of Katie, okay? It's the unwounded part. It's the part that most of us want to be in and want to live our lives in. And what number can you feel this at, the comfort and the love? If 10 is the most, you can feel it.
It's like an 8.
It's a lot. She's lucky.
Yeah.
I never feel this. Comfort and love. And this is really just a tiny piece of who she really is before anything happened to her, before she was lonely and alone and sad. She was comfort and love, and she will always be comfort and love. But sometimes we can't get to it because these other places are in the way. So this hand that is you, sometimes I ask people to speak from the hand. I am. Speak from the hand.
I have love.
So when she speaks from the hand, she says, I am love. And breathe this hand down to that 7-year-old. Breathe it down. And see if she takes it, only if she wants it. Let her surrender into the hand if she wants it. And if she does take it, let me know. So keep looking at her. So she doesn't take it, she still wants to be seen. So she wasn't seen. So it's your job right now to see her in her sadness, in her loneliness, and that you can see her. And that you know this is here. Not every part is ready to take it yet, but it's here. She is love and she is comfort, and she can give this to this kid that's inside of her when she's ready to take it. We don't try to make anything happen. We just go with what is. But know that this is who you really are. Before you were left alone, before you were sad, had all the sadness around it, this is who you really are. Yeah. And she needs to be seen. So keep staying with her. And tell me what you see about her. What is it that you see in her when you look at her right now? You see innocence. What else?
She just wants to play.
Yeah. Be her. Enter her. Speak from her. I am.
I am happy and joyful. Sometimes I feel really lonely.
I'm happy and I am joyful, but sometimes I feel really lonely. She also said a moment ago that I just want to play.
Yeah.
She just wants to play. What do you really like about her? Or love about her?
Her gentleness.
Yeah. She loves her gentleness. So the way we come home to our hearts one way, look how gentle she is. Take another breath and just look at how gentle she is. How gentle you are, Katie. And how much you just want to play. You just want to play. Your innocence, you mentioned innocence, gentleness. Just want to play. Yeah, just look at her so you can really see her. That's all she wanted. She didn't want to be left alone. She didn't want to feel lonely. She just wanted to play. Yeah. And she was innocent. And you still are. That thread also comes all the way up to now at 37. The part of you right now that just wants to play in your life. The part of you that's innocent. Yeah, let her be here. Yeah, keep seeing her. Most of us never got witnessed in our pain. Most of our parents never saw how much pain we were in. It's really up to us right now to turn around and look at ourselves and see how much pain we're in and to give ourselves what we need. And these kids inside of us know what they need. We don't know. We would have given it to them. If we knew in our minds, if Katie knew 5 years ago what this little kid needed, what she needed, she would have given it to her. If she even, I don't know if Katie knew that she had this kind of love inside of her. Did you? This kind of comfort inside of you already? It all gets blocked by the other stuff. She's probably been running the sadness and the loneliness. Am I wrong or?
No.
Yeah, not wrong. Because the thread follows all the way up to now. Another breath. Yeah. I'm going to end this part of this right here and just keep coming in and seeing her. And thank you for watching this. And this is just one tiny piece that I'm doing with Katie right now. There's many points. I can go to the scapula. There's actually holding here, there's holding here, holding here. There's points on the front. There's the mask that we wear. And in these videos, I'm going to go do different parts of the body and explain what they hold. So thank you for watching.